My name's Alison Coates. I work in the School of Health Sciences. I'm the director of the B-Nurse programme there. If medicine is an arm of the state by which control is exerted on the population, what purpose does it serve the state to develop a whole subsystem called psychiatry? Why not just lock people up in prisons who don't conform? And also, does this role exist throughout different political systems? Does it serve the same purpose, say, in the East as it does in the West?
Your first question is, why don't people just lock people up in prison who don't conform? You want to answer your own question?
I know how I would answer that. I just wondered what your explanation would be.
I don't have an explanation. I have a statement. Because it's illegal for the state to lock up anyone who has not been duly convicted of a crime. Thank God, this is the rule of law, a great English inheritance. And in America, you cannot go to a prison and say, please let me in. The judge cannot say, I don't like your face, you are acting crazy, I will lock you up. There has to be a justification for it. Now, there are only two justifications. One is law-breaking, the other one is mental illness. And this is what I have objected to. This is where I came into the picture. I realized this when I was 5 years old. This is not something which I learned in medical school, that there's something wrong with this system. Now, why do we have this system? Because modern society needs it, because a criminal law is too blunt an instrument. It does not protect people from civil injuries. There's a huge literature on this. Some of it was contributed by a good friend of mine, a wonderful man, died too young, Irving Goffman, famous American sociologist, and many others, around this subject. We don't have to invent the wheel. This is psychiatry. If we didn't have psychiatry, we would have to invent it. It fills a huge gap, because most people who annoy people are not criminals. Most people who are locked up in America are totally innocent in a human sense of any crime. 90% are lower class blacks locked up for drug offenses. What's a drug offense? That you sell heroin or cocaine to somebody who wants to buy it. That used to be called free trade by Adam Smith. Thank you for laughing. If you sell alcohol, that's trade. If you sell cigarettes, that's trade. If you sell marijuana, 20 years in prison. And if you are upper class, then maybe 2 weeks in a mental hospital. Or if you're a movie star, then you go into rehab. And then the judge says, okay, you have already served enough time. So it is a social control mechanism that supplements. If you read my books, you will see more than once I have said psychiatry is not a branch of medicine. It's a branch of the law. Unlike endocrinology or ophthalmology. Psychiatry has always been a branch of the law. We have mental health laws everywhere. What's our mental health laws? We don't have cancer laws. We don't have pneumonia laws. It's obvious. That doesn't mean that I am against voluntary psychiatry anymore. I am against voluntary religion. I'm entirely in favor of psychiatric acts between consenting adults. It's a play on sexual acts between consenting adults. Including lobotomy. You want a lobotomy? Have one. Electric shock? Have one. I believe in freedom and responsibility. But it should be your decision, and preferably you should know what you are doing. But if not, that's your problem. After all, getting married is very dangerous. Nobody can stop you by law from that. Having a child is very dangerous. Very dangerous. You can have a malformed child. You all know how. Life is full of terrible risks that we take. And it's not limited to psychiatry.
The second question was just, does this situation exist in all societies, you would say? There's no difference between how psychiatry is aligned to the legal system in other countries. It serves the same purpose, does it?
course it plays the same role, except it doesn't play the same role. It's wonderful. I mean, the English papers used to be full of, American papers used to be full of the political abuse of psychiatry in the Soviet Union. If they do it, it's an abuse. If we do it, it's great medicine. What was abusive about it? They had diagnoses, creeping schizophrenia and whatnot. We had, you know, in America, in the 1830s, 1840s, before the Civil War, there was a diagnosis called drapetomania. In a way, I have by accident discovered this historical fact. Since then, this has become quite well known. I wrote a very early paper before. If you go to the internet, you can see that the very first paper on this subject was written by me. You know what drapetomania was? Well, you know. Thank God. Made up a Latin term, the slave that ran away from Louisiana to Chicago, because he was crazy. He had it so good, exactly like in the Soviet Union. It's so good here, everything is for you. If you want to leave, you must be crazy. Exactly like the mental hospital. You go in voluntarily and you say, doctor, this has been wonderful. I'm now ready to leave. Then they clock your door. Now, these are facts I'm telling you, it's not an interpretation. And I'm saying that there can be no progress in this field until this is taken care of. First, you have to abolish slavery. Then you can work on freedom. I mean, that has been a curse on American history, which still hasn't been worked out. Once you make one of these mistakes, it's very serious. The consequences of slavery are very much alive in America today.
Hello, my name is Mary Nettle. I talked to you briefly earlier. I'm very interested about what you're saying, but I'm thinking that you're saying that psychiatry treatment for mental illness is okay as long as you agree to have it. Now, that doesn't take into account the power imbalance that psychiatrists can exert an awful lot of influence on you, which means that you may agree to something like electroconvulsive therapy or shock therapy, which if you had had all the information about the side effects, long-term, short-term, if you were in a position at that time to actually absorb that information. So I think it's very difficult to actually have voluntary treatment in the current psychiatric way of practicing.
Terrific point. But you are making two different points which I like to separate. You sort of added on that it's very difficult to have voluntary treatment in the current situation. Yeah. Now let's go back to the first half of what you said, which is a power imbalance between an expert and a layman. That is the underside of Adam Smith's free market and specialization in any field. Supposing you have a defective washing machine, now whether or not you should spend 20 pounds repairing it or getting a new one may depend on the opinion of an expert, and so on. Supposing you want to go and you're looking for a hotel in Timbuktu in Africa, you like to travel, but unless you know someone who has been there, you may depend on the opinion of a travel agent. This is, you are pointing out to the problem of having to be a careful decision maker in a free society. I have no answer to that. But it connects to the second part of the question. The answer to that dovetails with the importance that the expert should be on tap, not on top. That's an American, I didn't make that up. It says it all. He should not have any power over you. He should not be able to force you, use the force of the government. The force means the state, some agent of the state, whether he's in a blue coat or in a white coat. But your question is insoluble because it cuts across, supposing you have a back problem, which I had, a lot of people have, but should you have an operation for it or not? And your life can depend on it. Because maybe it will work, it very often works, it very often doesn't work, and the person is permanently in pain and worse off than before. It's a gamble. What do you know about the person you marry? going back to that. You certainly don't know what kind of child you're going to have. I mean, biologically.
Yeah. My name is Tracey Holley. I do a lot of teaching input in higher education with mental health nurses and social workers. And I'm an expert by experience as I'm a mental health survivor of depression and anxiety. And I would just like to know your opinion about when dealing with really vulnerable people, whether they be children or adults, would you go about protecting people who haven't got as much information?
I can give you a very glib answer. I don't mean it glibly, but that's all I can say is by giving them more information, by warning them against do-gooders. That's again an old American saying. I think David Thoreau, the famous writer, anti-slave abolitionist, said, if I knew that tomorrow morning a man is coming to me and would say, I am from the government, I am here to help you, I would run as fast and as far as my legs would carry me. That was David Thoreau, right? Now, again, that paraphrases, instead, you have to give people information if you want to help them with this informational problem. And again, I am now going to say something which which I hope will not offend any of you. There is a strain of paternalism, what I call paternalism, in the last few questions. And I'm a strong believer in every individual having a God-given right and obligation to assume responsibility for his or her life, which includes informing himself in this day and age. If you don't inform yourself, you are a dead duck. This is why intelligent people are eager to have their children well educated, so that they cannot be too easily fooled, misled. Why did all these people stand in line for the Hard Rock landing? Evidently, they made a mistake, or they thought they made a mistake. I mean, trivial examples illustrate this point. Who informed them? Nobody. They were misinformed. And you see, who will inform them? How do you tell the difference between the person who is out to inform you or misinform you? I have been attacked. Not anymore. I'm too old now for people to bother. Which is just as well, for misinforming people, for turning people away from, quote, psychiatric help. It's correct. One man's information, other man's misinformation. Are you satisfied? Because this is a very important question. It touches on the other question about the power imbalance.
I think knowledge is power, and information is very empowering. And for myself, coming from a victim of mental health services, let alone this so-called illness, because I've been informed, I've got education about it, I've learnt about, myself as an individual up against professionals, etc. I know the importance of being informed, and sort of readdressing that power imbalance too with that.
But look, let me give you a personal example. We are all in this game together because we are all in life. How come I am sitting here now? How come I wasn't killed during the war, in the Holocaust? My parents, my family, my brother, we were better informed and decided to leave Hungary in 1938. Well, what was the difference between all the hundreds of thousands of Jews and also some non-Jews who left Europe, who left Germany, and who didn't leave? Information. The typical belief was nothing can happen here. This is the land of Goethe. Goethe was a great German poet. This is a land of culture, and Germany was. Germany between 1870 and 1933 was the most cultured, most advanced country in literature, in science, in movie making, in technology, in physics. And it doesn't take long to change the playing field. Now, depending on what you know, what information you have, what misinformation you listen to. The typical story that people told each other, don't leave yet, just listen to Hitler, listen to how hoarse his voice is. He has cancer of the throat. He will die soon. I'm just mentioning one of these stories from my teenage years. That's information. And then there was a further question, let's say for so average Hungarian, should you go to America or should you go to Russia?
Hello, I'm Dawn River. It's just a small point to follow up from what you said. Isn't it a question also of personal resources? So it's not just intelligence or knowledge. But for example, I believe you went to stay with your brother in the States and you had that opportunity, maybe because you had the resources to do that. But for those people that don't have the wealth or the opportunity, and I'm talking now in terms of accessing services or resources that might help them, where does it leave them?
Traditionally, and I can't improve on that, people who were not as fortunate as other people were traditionally helped by religions and philanthropists. Well, we don't have the chance to look at great art, so, you know, philanthropists create great museums, so we can look at it. That may not be a very good answer to your question, but I don't know any other. Again, you are asking how to make life more fair.
I'm just saying that there may be a part of paternalism to play. I'm not necessarily in favour of paternalism, but I suppose I'm wondering whether there isn't, in fact, a place for paternalism when people themselves don't have the resources.
I should have qualified. There is absolutely a place. I have no objection to paternalism as long as it's non-coercive paternalism. I should have added that. There's nothing wrong with paternalism. In fact, paternalism is inherent in any helper-helpee relationship. Certainly any parent-child relationship, even among these good friends. No, there's nothing wrong with in that sense, with paternalism. I mean, certainly if I'm a much younger person, again, this becomes a matter of age, but when I was young, if I would go to, which I didn't do, I mean, it's a bad example, but when young people go to a doctor, if the doctor is any kind of if a decent human being, he will be paternalistic towards this younger person. And in the old age, of course, the male-female relationship was paternalistic. Very often in a benign way. I mean, there's benign and malignant paternalism. No, there's nothing wrong with paternalism. But it can be very bad. I mean, if it's between whites and blacks, let's say, now, you know, ipso facto, you paternalize them, that would be resented. Again, it depends. You have to, it's common sense. And there are nuances. But you're absolutely right. Paternalism is, it's coercion. It's always coercion, because that's, after paternalism comes the coercion. I mean, if I know what's good for you, then somehow it's become my responsibility to make sure you do it, regardless of your age. Now, certainly, I mean, if you have a 2-year-old child and you believe in scientific medicine, you'll have it immunized against certain diseases. But what are you going to do with your 22-year-old daughter about papilloma injections? You know, now they have this vaccine for cancer of the cervix. Now, supposing you are a doctor and you are very knowledgeable and your daughter says, is some health fanatic and says, no, I don't want any injections. Well, what are you going to do? You can't force her, and the doctor has no power yet. Only the state does. And psychiatrists cannot yet commit this girl for refusing. Now, in America, millions of children are on Ritalin. Now, if you are happy with that, then that is where paternalism will get you, and that's where medicine will get you in psychiatry. That is the new lobotomy. And now they are complaining that they are not getting enough treatment for depression. Now, when I went to medical school, there was no such thing as childhood depression. Why? Because it was assumed that children would be depressed. Why shouldn't they be depressed? In my opinion, why shouldn't anybody be depressed? I mean,
it's the same response.
I'm sorry?
Difficult situation. Depression is often a sane response to a difficult situation.
To a depressing situation. Exactly. I mean, depression is exactly like pain. I mean, somebody, if you have a disease or if somebody is stepping on your toe, or you cut yourself, you have pain. I mean, it has meaning. And so does schizophrenia, in my opinion. It's a little more subtle, a little more complicated. But depression is self-evident, and that's, you know. But you see, instead of just depression, we're calling it sadness, we now have clinical depression. It's called word magic. Nothing new. It's pure word magic. Clinical. Everything is clinical. Clinical research, clinical findings, clinical social work, clinical psychology, clinical this, you add that word, boom. Nobody can touch you.
My name's Jane Ledbetter. I'm an educational and child psychologist, but I work at the university. I was just wondering about you, going back to the initial points you were making about the intervention of the state and coercion and control, and wondering about how that fits with care and control with children, which we're generally quite happy to exert in a good balance, and care and control with people with learning disabilities. Again, there's not so much problem with intervention there. It seems it's with mental health, and particularly the state, as you said. So I just wondered if there's the individual exists and they take control of their destiny. Is there a place for something like the family to exert control?
I was waiting for some question like that because this very much belongs to the discussion. Children, in one sense, you know, the management, the policy towards children is in some ways presents no problem and in some ways makes it much more complicated. Now, it presents no problem in the sense that children do not, politically, morally speaking, deserve non-coercion. They deserve to be coerced, in my opinion, and this is the way the law is also. That is their job, to be coerced. And the person who was most eloquent about this is John Stuart Mill. If you read John Stuart Mill, I hope you all know who he was, great American social philosopher, later a utilitarian. John Stuart Mill, he is very famous for saying that society, and this pertains to coercion, this pertains to your question, that society has 18 years in which to educate and coerce and mold the child to make an appropriate citizen, Englishman. If society has failed until that time, that does not entitle it to continue to be coercive. That there is no coercion after age 18. Now, ideally speaking, children are the property, almost literally, of the parents. And if all goes well, that works. If it doesn't go well, then the state steps in, which already the ancient Romans called parens patriae. The patria, the state, becomes the parent. I don't have any better remedy. Then you can only hope that the state, through its agencies, does a good job. Because the child is, you know, and you have anything from very good foster parenting to foster parents or homes where the children get raped and used for pornography. I mean, again, it comes down to the human being. I mean, there are good human beings and there are bad human beings. Now, if you fall into the hands of bad human beings and they're powerless, then your life probably will be ruined. And there isn't anything anybody can do about it.
Do you think it's at all damaging to your credibility to be seen to be associated with Scientology, which in my view is a pretty coercive, totalitarian sort of a organisation?
You don't speak proper English. Because if it were a coercive organisation, then it would be illegal. You see, you are simply ventilating your prejudices when you say this kind of thing. It is no more coercive than the Catholic Church or the Jewish synagogue.
You're quite comfortable about your relationship with Scientology then?
Well, you don't know what my relationship is.
Well, perhaps you could explain it.
No, there's nothing to explain. If you read anything that you know, that I held these views 20 years before there was Scientology, was interested in this.
I know that you're a founder member of Citizens Commission Against Human Rights.
And what is that? What is the main job of the Citizens Commission?
It's funded primarily by Scientology.
It's not primarily, it's funded entirely by Scientology.
So you're comfortable with that?
Just like this session is funded by the University of Birmingham.
You've actually put your name to an organisation which is funded by a cult, which is based.
Now wait a minute. A cult is a delusion. See, one man, if you believe in it, it's a religion. If you don't believe in it, it's a cult. Wasn't Christianity a cult?
No, probably.
Never. No, let me answer that. I found it CCHR because it's the only organization still, and I'm still happy to be associated with them. It's the only organization that has lots of money and will hire lawyers to get people out of prisons called mental hospitals in America. It continues to do that. If you are now a down and out person in a mental hospital, locked up, you will not get out.
So if you thought somebody was being coerced by Scientology, would you be able to speak out against it?
Not only would I speak out, but excuse me, if somebody coerces somebody and this is known, then the police come and arrest you. It's called assault and battery. You see, you can listen to television and you hear the story about O.J. Simpson going into a motel room and not letting somebody leave. If you don't let somebody leave for 3 minutes from your office, you're a dead duck. You have kidnapped him. That's a law. You cannot deprive someone of liberty. In America, I can have a heart attack and you can take me to Bellevue Hospital while I'm unconscious. And when I come to, I can sign a piece of paper and they have to let me go. Unless they call in a psychiatrist and say I'm psychotic. That's what the mental health is for. But you see, now you are doing something which I didn't expect here, but it came up in the seminar in London too. And I was in Dublin before coming here. Always somebody brings this up because this is when you don't know what to do with a message, you attack the messenger. I mean, how is my association with Scientology any better or worse than if I was associated with Orthodox Judaism or Christianity? I mean, I personally am not religious. And Scientology is an incorporated, legally incorporated religion in America. Now, you throw up your hand.
I don't want to hog the debate, that's why.
Well, no. Well, you are not debating. I mean, you are calling it a cult, which already settles the argument.
Ric Bowl, I teach here at the university. I want to go back to something which someone else alluded to over there, and that is, I'm not sure about the distinction that you're making between coercion and these freely entered into psychiatric exchanges, because I think that the very existence of the coercive psychiatric system, for example, the possibility that someone can be compulsorily detained in hospitals, surely shapes all the interactions that take place. You referred yourself to the possibility if someone wanted to leave hospital that the door could then be locked. But I think it goes even further than that, doesn't it? In that the very existence of coercion shapes everyone's perceptions about what's happening to people who are psychologically distressed, and therefore I'm not sure that anyone really ever freely enters into any sort of psychiatric exchange.
I appreciate this comment very much because I made this point already in the midst of mental illness 50 years ago, and I have argued this point all along, that this is, see, in some ways, thank you for coming after this discussion, that this is a profound deception of psychiatry which represents itself as we well, like dermatology, that you come to a doctor and so on. And this is actually based again on a historical model. This was not as bad in the 1940s as it is today, as obvious, because historical model was that there was psychiatry. The historical model being the modern historical model is Freud's Vienna. Now in Freud's Vienna there was psychiatry, which was a state hospital system or the private hospital system, sanatorium system. Those were psychiatrists. And then there came into being this new phenomenon which Freud called psychoanalysis. Now if you now read again, this has to do with language and how we understand things. If you now read an ordinary dictionary entry about psychiatry, psychology, then Freud will be identified as a Viennese psychiatrist. He was never a psychiatrist. A psychiatrist was then a state hospital employee. And this is the reason, now this may seem like a digression, but this is very interesting and very important. There were virtually, so there was really only one exception to this, that was Lombroso, and that was in northern Italy. There were no psychiatrists at the turn of the century who were Jewish.
Who were Jewish, did you say so?
Yes, who were Jewish. Now, psychiatry somehow subsequently became a kind of a Jewish specialty. Well, how come? Who were the great psychiatrists that we talk about? Kraepelin, Bleuler, Kretschmer, and so on, Charcot. They were all state employees. The kind of anti-Semitism that prevailed in Central Europe, they could be no more they could be a psychiatrist no more than they could be a general in the army or a member of parliament. That was ridiculous. That's why psychoanalysis became, quote, the Jews. They were all Jews except for Ernest Jones and Jung, who then left. So the reason being that in, let's say, 1900 or 1910, if you went to a person identified as a psychoanalyst, he would not have thought of doing anything involuntary. He didn't have the power to lock you up. You could go to him and say, I'm going to commit suicide. By the way, suicide was very common, both among psychoanalysts and their patients in those days, 1900 to roughly 1930. So, especially in America, after the 1920s, 1930s, psychoanalysis became a branch of psychiatry. And this phenomenon developed, that there was de facto, and in fact, one of my more recent books written about, published about, I don't know, 9 years ago, it's called Liberation by Oppression. Liberation by Oppression, which in part I discuss this phenomenon of how everyone who now goes to a psychiatrist is entrapped. And that's why this in some ways has nourished patient liberation movements. Because people quite often don't realize what they are doing until they are caught, or like you described. There cannot, but that's self-evident that there can't be any voluntary psychiatry in a situation where the expert to whom you go is in fact an agent of the state with the power to lock you up, and not only the power, it goes much further than that, with a duty. I mean, this is a gold mine you are opening up, and I've written extensively about that. If the psychiatrist doesn't lock you up, and you are a hedge fund manager, and you go out a week later and you kill yourself, because of your bad relationship to your wife, whom you are too guilty to leave, and instead you kill yourself, the wife will sue you, and you are a dead duck. Your malpractice insurance better cover you for $30 or $40 million. Because there is no way in which you can protect yourself from the duty to protect. That is paternalism. Just like a parent will be held responsible for what his 5-year-old child. Very famous, not very famous, famous to me, professor of English named Richard Weaver wrote a book with this title, Ideas Have Consequences. To me, these 3 words are so powerful. Because ideas lead to actions. Now, this idea that the psychiatrist should be responsible for patients in a way in which no other doctor is, also opens them up to these responsibilities. And this is quite pervasive. What is the responsibility for priests abusing boys? Those stories about it from America. And then it turns out that many of these priests were, when they were denounced, or it became known that they were misbehaving, instead of being fired or gotten rid of, were sent to psychiatrists and reassigned. And then they molested children again. I wrote a paper about this too, a very long paper, which is being republished. I think it's already out, was published this month, called The Medicalization of Everyday Life. That's what we are now talking about, which is rampant in America. It's a collection of essays, there's only a new preface to it. But we are talking about the medicalization of life. Obesity, anorexia, internet addiction. I mean, these are now the new diseases, the new drapetomania, gambling addiction, 12-step programs, religion, coercion, everything all mixed up. Because a 12-step program is essentially a religious kind of thing. You appeal to higher power. And there are suits about this, the separation of powers between church and state. You know, America is a highly litigious country, and these are all interlapping issues around the issue of coercion. That is always a cutting edge.